Hi, my name is Robert Chelle with Chelle Law, and I'm an attorney that assists dental associates with employment contract and independent contractor agreement issues. Today I'm going to talk about dental associate contract red flags. So what are some things that you need to identify when you're reviewing the contract, and then some possible ways to avoid some of those potential red flags. First would be some compensation concerns. Now, it is very common in the industry to start with a daily rate or some kind of guaranteed amount and then switch to collections within a certain period of time. Sometimes they'll say 30 days or 60 days where you get the guaranteed daily rate, and then it immediately switches to a collections model, usually for the dental industry somewhere between 30 to 35%. I would want that period much longer than a month or two. It takes time for anyone to build up a practice, usually 12 to 18 months. It's kind of a good rule of thumb as far as when your practice will reach maturity. And you're getting familiar with a new environment, new hygienists, new assistants, the workflow might be different, new kind of medical record system. And so it simply will take time for you to build up. And if you go straight to collections very quickly, it could really hamper the compensation. And it's totally normal to be kind of have a low productivity at the beginning, and then you ramp up over time. So I would make certain that the guarantee period is at least 6 months. A year would be ideal. All right, so that's the first thing. Not having any kind of details about schedule, days, emergency call responsibilities. That's a big issue as well. Many employers, for whatever reason, don't want to get locked into a schedule, but you want to make certain that they can't unilaterally jerk you around as far as your schedule and your hours and call. Now, call for most dentists is not that big of a deal. I mean, if you're in like a private practice, there may be like 2 or 3 occasions annually for you to actually have to come in. But as far as the schedule and the hours, that's something that should be spelled out in the contract. And then it also needs to say, if the employer wants to change those, that you will have, to mutually agree on those changes so that you can agree. If you're fine with whatever changes they propose, then that's great. But they shouldn't have the ability to just do whatever they want as far as your schedule goes. Non-compete, you need to be very careful. You're not going to sign a non-compete that could potentially, knock you out of the city where you live. You want to limit the scope, meaning what you can or can't do. You want to limit the time period, I'd say no longer than 1 year. And then the geographic restriction, ideally 5 to 10 miles from your primary practice location. Now, that does depend where you are. If you're in New York City, it might be a few blocks, whereas if you're in a rural environment, perhaps there's no other game in town, and you don't have any other opportunities to go anywhere else. So limiting the non-compete language and making certain that you can continue practice is important. Non-solicitation is important as well, especially in the dental industry when people are rather tied to whoever their doctor is. You want to make certain that you can continue to treat your patients if they decide to follow you, if you haven't solicited them. And so what I mean by that is, let's say you do establish a practice outside of the non-compete radius. You want to make sure there's no language in your contract that says you can't treat or assist, or there's many different kind of words they can use to try to be sneaky about it. But you want the ability to provide care to patients that want to follow you. So sometimes they'll put like penalties in, or you have to pay the old practice for the charts, or if a patient receives any services from you. I wouldn't agree to any of that kind of stuff. If it's outside of the non-compete radius, it should be fair game as far as who you do and don't treat. Malpractice responsibility, is it an occurrence policy? Is it a claims made policy? If it is claims made, who pays for tail insurance? That should be spelled out in the contract, and you want to make certain it's favorable for you. Termination, most dental contracts have somewhere between a 60 to 90 day without cause termination. So you want to make certain that it's the same for both parties, and then it's not very long. Like 180-day notice is much too long. It's going to stop you from being able to find a new position because many places aren't going to want to wait 6 months to fill whatever need they have. So you don't want to go more than 60 to 90 days. And then last thing about compensation, if you're paid a collections-based model, you want to make absolutely certain that there's language in the contract that says you will get all of the collections from any of the services you provided while employed with the company. And so what do I mean by that? Let's say you have a 35% net collections compensation model. Many of the contracts will say your compensation ends at the date of termination. Well, if you're only paid on collections, then in the average accounts receivable cycle for an insurance claim is 30 days, then you have worked the last month and none of that money has been collected. And if there's language in the contract that says it ends when it terminates, you're not going to get any of that money, which is not fair because you did the work and you should receive the money. So make absolutely certain there's language that says you'll receive any, I call them trailing collections that come in after the contract terminates. All right, those are some red flags for dental associate contracts. If you have any questions about your employment contract or independent contractor agreement, feel free to contact my law firm at the information listed below in the description. And I appreciate you watching the video. All right, thanks. Take care.